Heard, how's it going? We're here for another news update. You ready?
I'm ready. Let's dive in.
All right, let's dive in. So we got four big stories today that are really leading. Let me give you a overview of what those are. It's about potential Medicaid cuts. It's just where are we with the tariffs and its impact on the supply chain. M&A updates with a little bit of a look at what's happened a year after Steward. And then this interesting thing about the healthcare escape room. There's a fantastic article that Herd and I are going to hit. So, okay, with that, Herd, let's get into it. So, tell me what happened last night. It looks like this big, beautiful bill moved forward, and there's a lot of concern with hospitals, C-suites about Medicaid cuts. So, walk us through that.
Yeah, there's been lots of talk, obviously, about the bill, and it passed last night at the House. I think it passed this by one vote, I believe. So narrowly squeaked out of the House, and now it goes to the Senate, and we'll see what changes happen there. But right now, there's lots of key provisions that affect Medicaid, and I think the biggest one is there's addition of work requirements for Medicaid. There's some restrictions on care for undocumented immigrants. There's increased eligibility verifications. And so I don't think the bill is cutting Medicaid per se, actual rates, but they are increasing these other areas that will potentially push people out of Medicaid. And so that could have an impact on hospitals, on our clients if they treat Medicaid patients. Where are they going to get care? The people still need care, right? And so it'll be interesting to see what kind of strain potentially that puts on hospitals.
Yeah. I'm seeing as much as anywhere from 7.6 to a little bit north of that, as far as 7.6 million people that would be affected to not have Medicaid anymore. Right. Obviously, that's going to put them into potentially self-pay categories, hopefully into insured, but a good chance that more would go to self-pay. So, okay, with that, the tariff thing continues, Herd. It's just so interesting. So there's two articles that we found this week just on the pharmaceutical tariffs in particular are going to have a potential 12.9% increase in all of our pharmaceutical costs that'll ripple back to the hospitals and docs. And then the second one, that's a really good article in Modern Healthcare in the last week, talked about the implication for 340B costs to go up, the hospitals using that program, and it's going to put more scrutiny on the 340B program from politicians looking at that, saying, the hospitals are using that, gaming the system, and then putting that on the federal and state, backs to bear the weight of that cost. What's your thought on the latest on the tariff?
Yeah, I mean, the latest, we've seen over the last few weeks, maybe some pulling back. There was really kind of the surprise announcement on China, and it sounds like there's been some productive talks there. Some of the extreme tariffs that were announced, the 140, 150%, I think that's been backed off. There's a 90-day time where they're doing some negotiations. So really we'll kind of see where that settles out. I think there'll be some tariff level that's there. I mean, they've already have the 10% that's been added and possibly more. And so that'll be interesting. Some news came out this morning. I know there's conversations going on with some of the European Union countries. Those talks, I think the story in the journal that I read, they're not going or not as productive as others. And so the markets are kind of reacting to that. And so I think it's still open. I think, prognosticating the tariffs won't be as extreme as initially announced. So I think that will help with costs. But there will be something. And what that something is, we'll see here hopefully in 90 days or so.
Yeah. Okay. Yep. So stay tuned on tariffs. Then flipping over to M&A, we do have, I will give a plug. Herd and I just had an interview with a couple of great people, and we did a podcast on the latest and greatest trends in M&A. So I'd encourage everybody to give that a quick listen. I think that's probably a 25, 30-minute listen and go through a lot of stats by sector on that, which I thought was really good. The one article that came out in Healthcare Dive I thought was really interesting. And Steward Health in particular, it's a year after the demise of Steward Health. and what in particular has happened to many of those hospitals. So they had 31 hospitals. 5 of those have closed. 2 are paused operations. And then there's still a lot kind of, I would say, a high wobble factor with especially some the MPT actions. And then even there's still some unknowns about those hospitals going forward. So, but overall, I think from an M&A perspective, Herb, we're seeing, nice deal flow, but still some hesitancy just because of the greater economy, right?
Yeah, I think we'll cover this in more depth where we do on the M&A podcast. But it's there's lots of bright spots, but there's a lot of uncertainty out there, and so we're kind of seeing people proceeding optimistically, but also cautiously is the read on that. And I think the stories like the Steward thing, I think there's a lot of operators out there, a lot of investors. They want to do the right thing.
Yeah.
They are in this for the right reasons. And it's a matter of let's make sure that we are proceed accordingly, as opposed to you don't want to be a headline in the the news, especially something that reflects negatively on your industry. So I think we're cautiously optimistic. I think it's the tone where we are right now.
Yeah, yeah, and just a word. I'm referencing all these articles. We'll do our best to try to put links to these articles in the notes to the show, because I think that would be really good, because there's real depth in each of these articles that Herd and I are referencing. And to that point, the one that I really want to highlight is one on MedPage. MedPage is a place where Herd, you and I generally don't necessarily go to, versus Health Leaders or Health Affairs or Modern Healthcare or whatever, or Becker's. But MedPage, this one is so interesting, and it's about the healthcare escape room. We just thought that was funny when we saw that. But when you read the article, it's by this guy who I didn't know. He's a little unknown in healthcare, but it's just really, really insightful about how complex our healthcare system is. Let me give you 2 quotes, Herb, before I get your reaction to this. Is one from Walter Cronkite, and he says the renowned newscaster Walter Cronkite nailed it years ago when he quipped that our healthcare system is, quote, neither healthy, caring, nor a system. I mean, it's kind of a dark quote by Walter Cronkite. Lord knows when that was, but that's probably 50 years ago. But he got something there. The second quote is around this article that shows the decline in primary care. And that's an article from Medical Economics. And it says that over the past decade, primary care visits among traditional Medicare beneficiaries have increasingly shifted away from physician-owned practice and toward clinics affiliated with hospitals, rural health centers, and large multi-specialty groups. And that was according to a JAMA study. It just goes to this healthcare escape room concept, goes to, we live in something you and I have talked about for years now. It's an exceptionally complex system. And when we say, and you're right, Herb, this guy acknowledges they want to do the right thing, but it's such a complex ecosystem that we live in that it's hard to do the right thing when you're trying to be financially viable as well.
Yeah, I mean, it's first of all, the title is nice and catchy, and I think
Right.
people, anyone who's ever navigated, getting a procedure and having to go through pre-approvals and getting cost estimates, and then you get the procedure done, and then you have bills from multiple people, and you sometimes get bills from a group that you have no idea who that is. Well, maybe it was a radiology group that read something that you didn't realize. We've been doing this a long time, and we understand it, and it's complex. People trying to navigate it, without the knowledge, it is it's a labyrinth. And so I think it's a great title, and really, when you look at our system, it's one that evolved over time. It wasn't set down and designed by anyone. You look at our insurance system, it really evolved out of a World War II wage and price controls, when employers started paying for health insurance as a way around wage and price controls. That's how we got employer sponsored insurance, basically, and that was something that grew out of World War II and what was happening then. So it's just kind of fascinating. You have other the deductibility of health insurance costs that businesses can do that people can't do. That came out of decisions that were made in court cases that were made on the deductibility of something. And so again, you have this system that's just evolved piecemeal over time, and it's kind of become a very complex animal. And so I encourage anyone to read the article. And it's one of those things that, as we all have to be educated on how to navigate this.
I agree. Okay, so that's it. Those are our 4 big stories and headlines. And again, we'll do our best to put links to all these articles in our notes. And we appreciate you guys listening this week.